You've been suffering with a disc bulge in your lumbar spine, your lower back. Maybe your MRI report said an L4, L5 disc bulge or an L5S1 disc bulge. And you want to get back to the gym. You want to get back to normal life. You want to start exercising again. Perhaps you've been suffering with this for several months or maybe for several years. Well, one of the most commonly asked questions I get asked is, which exercises do I avoid when I have a bulging disc in my lower back? So that's what I'm going to answer in this video. I'm going to talk about the 3 top exercises to avoid with a bulging disc. For those of you meeting me for the first time, my name is Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And what this channel is about is giving you tips and strategies on how to strengthen and stabilize your back. Like this, you can bend, move, and lift normally and without pain or limitation. Like this, you can live the life that you want to live. So if that's the type of tips and strategies that you want, then go ahead and click on that red subscribe button right now. Tap on all notifications on that little bell. Like this, you don't miss out on my weekly video updates. As well, if you're new to my channel and you just subscribed, let me know in the comments below and I will personally reply right back to you. In this video, I'm not only going to talk about the 3 top exercises to avoid with a bulging disc, but I'm also going to elaborate on those and give you some other exercises to also avoid. As well, I'm also going to give you some research on why I base these recommendations to avoid these exercises. So the first thing you need to understand is how an intervertebral disc responds under load in different positions of the body. So just take note of the slide right now. Understanding how an intervertebral disc responds under load. Load means weight, right? How gravity acts on your spine, right? Under load in different positions of the body. So if you look at this diagram here, you see the arrow, the red arrow is pointing through the top of the spinal column. Well, those discs, when they're healthy, they're able to absorb load or weight, the weight of your body and how gravity acts on that. Now, when the spine is in its optimal position, which is vertical and straight from the front or back, and in its natural curving positions from the side, in nice sagittal and coronal balance, which is a normal ideal, then the load distribution on the spinal column and on the discs are evenly distributed and they're handled very well and very healthy. Okay? So what I mean by load is this. So take a spine and your body weight or any excess weight on top of your body, like when you're weightlifting, for instance, it will begin to compress those discs. So they do have some ability to respond and act to the load on your body through your spinal column. Okay? Of course, when there's a disc injury, that ability to respond to your body's load, your body's weight, or other movements or other things you're doing in exercise may be hindered. So you have to be a bit more careful, okay? Now, what I'm basing this on is this research by Dr. Mackinson, MD, and he's done a lot of research on the load on the lumbar discs in different positions of the body. And this study was published in Clinical Orthopedics and Related Research. There's the reference right there in 1966. And this is what he found, okay? So again, as I go through the exercises in the next few slides, I want you to remember this particular graph plus the weight that I showed you on the spine, okay? So you'll see here, this red arrow, that represents a person, 70 kilograms, and there's 100 kilograms of weight on the third lumbar disc. It's L3. That's what he's citing, okay? The third lumbar disc. So 100 kilograms of weight. So you want to see what happens when the body is positioned in different positions, when there's extra weight added. Okay, so if you look to the left where it says 25 and 75, those are recumbent lying down positions. You can see that the actual load has decreased when someone is lying down, for instance, on a bed when you're sleeping, on your back or on your side. Now, if you look over here, the next red arrow where it says 150, a slight bending forward, okay? So slight bending forward, that actually increases the weight on the discs, the load, by 50%, up to 150 kilograms. As soon as you add a 20 kilogram weight, look what happens already. So remember during exercise, what could be happening if you have an injured disc. So this is very important research. So 20 kilogram weight, and you're bending forward in the same direction. Now the load on that disc at L3 increased to 220 kilograms. Okay, that's 2.2 times compared to here. Okay, now in the seated position, if you're sitting all day, at work, at home, in the car. There's also increased load on the disc at L3. Now, if L3 is increased in load, I'm assuming also L4 and L5 is also increased in load. But this research was done studying the L3 disc. So you see that there's an increase also in the seated position from 100 standing to 140 kilograms of weight on that disc. Now, when the person is stooped forward, flexed forward, people slouch in their seat. The load on the disc increases again up to 185 kilograms compared to the standing upright position. And when you're seated with that 20 kilogram weight now in hand, the load on the disc increases to 275 kilograms. So I want you to remember this research. And now I'm going to go into the 3 top exercises that you should be avoiding. And I'm considering that not just based on my clinical experience. I'll share maybe 1 or 2 stories of patients, but not just on my clinical experience, but also on this research. And I've always recommended people to avoid these exercises during the recovery stage and possibly even longer than that based on this research by Dr. Nakamsingh. Okay? And if you're enjoying this so far, do comment below and let me know what your thoughts are, if you like it, if you don't like it, if you find it useful, if you don't find it useful. And as well, do say hello in the comments and let me know where you're from. So let's proceed. Remember this picture, okay? So every time you're exercising, you have to imagine what the impact is on the load of your spine and on those injured discs. So exercise number 1 to avoid, seated hamstring stretch, okay? Now, I'm not only going to talk about 3 specific exercises and elaborate on them a little more and kind of expand on different exercises as well. But these are the 3 general ones I want you to remember. So seated hamstring stretch. So you can see when you're doing a seated hamstring stretch that you're bending your spine and you're increasing the load on those discs, like I showed you in that Nakamsingh graph, a Nakamsingh study, okay, from his graph, right? So this flexion, even though you're stretching those hamstring muscles, right? And hamstring muscles, when they're tight, they can affect the lumbar spine, right? It's a good stretch. When you have an injured disc, this should be avoided because that flexed forward stooped position is increasing the intradiscal pressure and you could be injuring those discs and not giving it a chance to heal. So that's number 1 to avoid. In the same category of this number 1 section is flexion loading type exercises, such as sit-ups, full crunches, abdominal twists, any type of twisting exercises. I would also avoid that. So a seated hamstring stretch and any type of flexion loading exercises I would avoid. All right, great. Let's get into exercise number 2 to avoid, heavy squats. I often tell many of my patients to avoid these. They like to do squats for their gluteal muscles and their leg workouts. Here are some examples of what they look like, whether it's in front of your shoulders or behind your shoulders. You can see that the extra weight on the upper part of your body is loading your lumbar spine unnecessarily. And when there's an injured disc, an inflamed disc, a ruptured disc, a protruding disc, annular fibers that are not healthy or not intact or torn, then you're more prone to re-injury or less likely to have a full recovery or an immediate recovery. So I would definitely avoid heavy squats. In the same category, in this number 2 section, anything that's press exercises. On the left, you'll see a seated squat press. Those I often tell my patients to avoid when they're recovering from a lumbar disc injury. Shoulder presses, whether it's with dumbbells or barbells, again, they're loading the spine. Even though you're not bending, you're still loading the spine through the column, and that could be irritating those discs that are trying to heal. Okay. Again, if you're enjoying this and you're finding this useful, please do comment below in the comments below. Tell me your thoughts, your questions, and let me know what you're thinking. Moving along, exercise number 3 to avoid, deadlifts, the dreaded deadlifts. I can tell you the most common injury from a gym exercise workout that people present to my office with when they tell me they have an L405 disc bulge or an L5S1 disc bulge confirmed on MRI is the deadlift exercise. Now, there are many ways to do it correctly. I'm not going to get into that, but there are also many ways to do it incorrectly, okay? This video is not to talk about the form of exercise, generally to avoid it. So I tell my patients to avoid deadlifts altogether. I know it's a great exercise. for the glutes and the legs and even the lower back, but there's a tendency to do it wrong, okay? Like the one on the left, full flex forward, right? That person is just looking for trouble. Increased load in the lumbar spine as they're increasing, as they're lifting the weight. The one in the middle, you can see that even though he's pushing through it, form is very bad. From a flexed to extension position with load, it's just asking for trouble. Now, the one on the right, the form is a little bit better. But again, if you're recovering from a disc bulge injury at L4, L5 or L5S1 or anywhere in the lumbar spine, I would 100% avoid deadlift exercises. In my personal opinion, I would avoid it forever and just substitute with something different, okay, to work out your legs. Remember, don't give up. If you're recovering from a disc injury, they take time to heal. I've talked about that in my other videos. Sometimes exercises are sufficient at home. Sometimes you need professional help like physical therapy or corrective chiropractic care like what I offer. There are certain things that you can do and certain things you should be avoiding. So in this video, we talked about 3 categories of exercises, 3 types of exercises, the top 3 exercises that I believe you should be avoiding. Go back and review that as well. I want to offer you some actual safe exercises you can do. Here's a video that I made that is very popular on my channel that shows you 4 beginner core exercises you can do to help stabilize and strengthen your back. This is a great way for you to get back into some exercise routine in a safe manner to strengthen and stabilize your low back. So be sure you look at that video right there, right now on the thumbnail. And as well, subscribe to this channel if you're new here and comment below. Let me know your thoughts and go ahead and watch that video right now.